Today we are going to explore the issue of access to early childhood education in Boston communities, specifically in preschools within the Boston area. There seems to be a lack of resources and funding for early childhood education programs, and in turn, a sufficient lack of opportunities. The State of Early Education and Care in Boston conducted a study that found although accessing care at all is a challenge, there is a greater gap with the availability of high-quality care. The State of Early Education and Care in Boston defines high quality as being a crucial aspect of early education and care programs. Children who attend higher quality early care programs have better cognitive and social outcomes related to kindergarten readiness. Children who had high quality early education and care had higher math and reading performance through adolescence, as well as higher earnings in adulthood. High-quality early care programs can help children from low-income households by providing consistent care and enrichment to gain the knowledge and skills that support cognitive development and school readiness. Now, this study did not find a Boston-wide gap for the supply of general care and pre-K opportunities for 4-year-olds, but instead, it found a gap in the availability of high-quality seats for 4-year-olds across the city. High-quality seats were defined as seats available from providers that had at least one of the quality indicators: a QRIS rating of 3 or 4, accreditation from the National Association for the Education of Young Children, or accreditation from other associations focused on quality in early education and care. Experts have been stepping in and providing their own definitions for the issue in an attempt to highlight how necessary it is that we take action and improve the quality of the preschooling systems in Boston. Stephen Barnett, the director of the National Institute for Early Education Research, wrote in his introduction to the 2015 State of Preschool Yearbook the following: "At the current rate, it will be another 50 years before states can reach all low-income children at age 4, and it will take 150 years to reach 75% of all 4-year-olds. The following figure shows the access and quality gaps for Boston children between the ages of 0 and 5 attempting to enroll in high-quality education. This data was collected after Boston created legislation for universal pre-K. Of Boston neighborhoods, this gap was greatest in Dorchester, East Boston, West Roxbury, and Charlestown, where approximately half of the children would not have had a spot. South Boston and the South End had a child care gap of 44 and 40% respectively. Jamaica Plain, Mattapan, Hyde Park, and Allston Brighton had a gap of approximately 30%, and Fenway Kenmore had a 22% gap. Roxbury and Central Boston had the lowest gap of 3.9 and 4.6% respectively. The only neighborhood with a surplus of seats, 36%, was Back Bay Beacon Hill. To provide further context, this map of Boston shows the number of children aged 0 to 5 by zip code. And this map shows the number of children ages 0 to 5 living in poverty by zip code. About 27% of children live in poverty in Boston as of 2017. Dorchester, East Boston, and Roxbury have the highest potential demand for early education and care. These neighborhoods are followed by substantial numbers in Mattapan, Hyde Park, Brighton, Jamaica Plain, Rosendale, and West Roxbury. Many government groups and programs are getting involved in an attempt to create some sort of solution that will support low-income families sending their children to preschools so that they have access to the high-quality care that is so clearly vital to their development. Head Start programs provide free early education and care options for income-eligible families. This federally funded program offers childcare in addition to nutrition and mental health services. Early Head Start serves children in the 0 to 2 age group, and Head Start serves children in the 3 to 5 age group. Even with these existing programs, Massachusetts is one of the most expensive states in the country for childcare. According to the State of Early Education and Care in Boston, By the time a child is in preschool, the average annual cost of care is $13,771, or nearly $1,200 per month. The Department of Early Education and Care received a federal preschool expansion grant that funds a year of free, high-quality preschool for 4-year-olds in 5 Massachusetts cities. This helps to support partnerships between public school districts and community-based programs. Massachusetts received the maximum eligible amount of $15 million per year. This $15 million will support full-day and full-year programming, joint professional development between the school district and community early education programs, use of highly qualified educators who are paid at a similar rate to public school educators, extensive family engagement and support services, low child-to-teacher ratios, meaning 10 to 1 or less, and workforce development support for educators. Another compelling change is the subsidy distribution by the State of Early Education and Care in Boston. The subsidy distribution is a provision of vouchers and contracts for early education and care. This table shows an estimation of the number of families in each region with children under the age of 5 that earn less than 50% of the state median income. As seen in the table, it is estimated that about 8,000 children are eligible for these monthly vouchers. The following figure shows the waitlist for these same subsidies in 2017. This just proves that while these vouchers are a step in the right direction to allow more children to access high-quality care and education, there is still a long way to go.